this for me. Try and spread your legs apart. Good. And bring them together. Very good. Very good. Man, you are. That's strong. Hello, hello, Mr. Dodd. We're back again. Good to see you.
Yeah.
Nice to see you as well.
Dr. Raterman, how are you,
Good to see you. Good to see you. What's happening today? I think we want to try and let the patients know that when they're in our office, they are the only and prime focus. And we have a team of people to assist them, from my nurse practitioners, Kim and Marlena, to a fifth-year resident who will be on the service with me.
Really good motion.
We specialize in joint preservation of the hip, which means we try to keep the patient's native hip in as long as possible. We do a lot of minimally invasive type procedures such as hip resurfacing and hip replacement.
The hip resurfacing changed my life. I walk normal, I don't have pain, and it's been life-changing.
7 years ago, he did a hip resurfacing for me, which has been fabulous. Allowed me to get back into all my activities.
What we're trying to do is keep people up and active as long as they possibly can, doing the fun things that they want to do.
For 30 years, I've walked with a limp. I could never cross my legs. Now I don't walk with a limp. I can fully cross my leg. He made me a new man at 69 years old.
We can treat a number of varieties of diseases without necessarily going to a standard hip replacement or a knee replacement.
I just went to London with my son for a week and we did a lot of walking, and I just had my right hip done 3 months ago, and we walked all around London for a solid week, and it was wonderful. I couldn't have done that beforehand.
I think the speed of the recovery has been the most gratifying thing over the last 10 or 15 years.
I'm Dr. Wilson. I work with Dr. Raterman.
Hi.
One of his residents. As a fifth-year residency, we work with Dr. Raterman for several months, kind of before we go out into our own practices or fellowships. Unanimously every year, it's one of the better rotations.
It's so important to pass on my enthusiasm for orthopedics to a younger generation.
While I do have an obligation to my patients, I also have an obligation to training others that come behind me for the betterment of our practice.
He is the #1 doctor that I've ever been associated with.
Can't say enough good about him. The guy is, he's great. And I feel very blessed that I found him.